Dear pelvic physiotherapist, my name is Sophie and I work at Novu Care Pelvic Health Limited. A warm welcome to this yMAPLe online basic training. You can also check out our publicly accessible YouTube channel where many trainings, instructions, presentations, and webinars are available, but today we will focus specifically on the use of yMAPLe. In this training, we will cover the basic functionalities and applications of yMAPLe. For more in-depth knowledge, you can participate in specific trainings on EMG and electrical stimulation, which will take place after this session. yMAPLe is a product of Novu Care Pelvic Health, a Dutch company based near Den Bosch. yMAPLe was introduced to the Dutch market in 2014 and is now available in approximately 15 countries worldwide, not only in Europe but also in places like Mexico, Malaysia, and Kuwait. What makes yMAPLe unique? It is the only unipolar product in the world that can provide a detailed 360-degree diagnosis of the pelvic floor using EMG. Furthermore, it enables targeted treatment with electrical stimulation and offers simple and effective biofeedback. Important, the probe is single patient, multiple use, meaning it is patient-specific and can be used throughout the entire treatment. yMAPLe originated from the Leiden University Medical Center, LUMC, where a urologist was looking for a product for precise pelvic floor examinations. The existing bipolar probes were insufficient because they measured the average activity of multiple muscles without distinguishing specific locations or depths. Together with students from TU Delft, LUMC developed a prototype of yMAPLe. The product was then further developed by Novu Care and validated with MRI scans. This validation showed that the data from yMAPLe corresponds with the actual muscle activity in the pelvic floor. Since then, extensive scientific research has been conducted worldwide using yMAPLe. These studies are available via PubMed or upon request from Novu Care. To provide some more clarification, we'd like to show this video, which makes the functioning of yMAPLe more comprehensible. This video clearly demonstrates how the yMAPLe probe maps all sides and depths of the pelvic floor in an organized manner using the grid. The deeper into the pelvic floor, the more information becomes visible in the center of the grid. The reliability of EMG and electrotherapy. The literature on EMG and electrotherapy shows considerable variation in results, mainly due to differences in study design and various types of probes. However, with yMAPLe, where the same test protocol is consistently applied, we observe consistent and positive results. In the Netherlands, yMAPLe has been used for several years in training programs for pelvic physiotherapists. It is taught at SOMT in Amersfoort and at Avans Plus in Breda. The Ministry of Health now recognizes yMAPLe, and some health insurers partially or fully reimburse the cost of the probe. A key difference between yMAPLe, unipolar probe, and traditional bipolar probes. Bipolar probes have two electrodes that measure signals from different muscles and calculate an average value. As a result, specific information about individual muscles is missing. Unipolar probes, like the yMAPLe probe, feature 24 independently functioning electrodes. This allows for the measurement of individual muscles and even the deactivation of other muscles to enable more targeted diagnostics. There is only one unipolar probe, and that is the patented yMAPLe probe. With yMAPLe, for example, you can measure only the puborectalis muscle and make specific statements about muscle activity. This is impossible with bipolar measurements, as signals are averaged over multiple muscles. A different perspective. yMAPLe measures the myoelectric activity and neuromuscular function of the muscle. This activity is influenced by asymmetries, such as pelvic floor damage from constipation, childbirth, or trauma. As a result, left, right, and anterior-posterior differences are often clearly visible. With EMG measurements using yMAPLe, you do not measure strength or movement, only motor activity. Therefore, interpretations like strong muscle or weak muscle do not apply. Rest and active measurements. Resting measurements, you can identify overactivity, high values, or underactivity, low values. Active measurements. You assess the increase in activity in specific muscles during contraction and how this increase and decrease in EMG activity occurs. Grid display for mapping the pelvic floor. yMAPLe uses an advanced grid display, a 2D representation of the pelvic floor divided into 24 quadrants, each corresponding to a specific electrode. This visualization prevents confusion from overlapping lines in a graph. The probe and electrodes are intentionally designed to be small, allowing them to lie directly on the muscle cell. Larger electrodes would cause overlap and less specific measurements. The yMAPLe probe is also small enough for both vaginal and anal applications. The probe consists of 4 sides and 6 rings. A side corresponds to 6 electrodes on one side of the probe: anterior, left, posterior, or right. For example, the highlighted plate is called the left side. A ring corresponds to 4 electrodes at the same depth on all sides of the probe. For example, the highlighted ring is called ring 3. Each of these sides and rings can be easily activated or deactivated. Views of the circular grid. The circular grid provides 2 different views which can be switched at any time during treatment. Operator view. The operator looks from the patient's feet upward. The right side of the grid corresponds to the patient's left side. The left side of the grid corresponds to the patient's right side. Patient view. The patient looks at the iPad screen during treatment. The right side of the grid corresponds to the patient's right side. The left side of the grid corresponds to the patient's left side. This is the preferred view for biofeedback purposes. EMG measurements can be displayed in 2 ways. Absolute measurement display. Measurements are shown in microvolts, MV, in grayscale. The darker the color, the higher the MV value. Comparison with reference display. Measurements are compared to a healthy baseline from a reference group and shown in colors. Red indicates more activity compared to the reference group. Blue indicates less activity compared to the reference group. White indicates EMG activity equal to the reference group. The more intense the color, the greater the deviation from the reference group. Note, this reference scale is solely for comparison purposes and not for diagnostic use. The absolute scale, grayscale, is best suited for that. yMAPLe measurement protocols and guidelines. The yMAPLe app contains pre-programmed measurement protocols. Here are some key measurements. Rest measurement. Duration 1 minute. The patient should not watch the screen or talk during the measurement. Inform the patient halfway through that 30 seconds remain. Maximum voluntary contraction, MVC. Purpose, to measure fast twitch fibers. Protocol, 10 contractions of 3 seconds each with 3 seconds of rest in between. Note, only the active period within the gray area counts. Endurance measurement. Purpose, to measure slow twitch fibers. Protocol, 3 contractions of 30 seconds each with 60 seconds of rest in between. Patient instructions. Ask the patient to contract firmly, but not at maximum effort. Ensure the patient continues to breathe normally. Measurement screen. The measurement screen displays feedback at the top of the display regarding the type of measurement, the patient's name or number, the reference group, and the comparison type. Measurement time and the average value over the active electrodes are also provided as feedback. After selecting the play button, the measurement begins. To stop the measurement session, select the stop button. A new measurement can be started immediately by pressing the start button again. When a measurement is stopped, the session can be saved or deleted. When saved, it is automatically stored in the patient's history under the current visit. Views of the circular grid. As previously indicated in this training, for the circular grid, 2 different views are possible: patient view and operator view. You can switch between these views at any time during the treatment. The grid has 2 different display modes: absolute mode and reference comparison mode. You can switch between these displays at any time during the treatment. Electrostimulation therapy guidelines. Here you see an overview of possible settings for electrostimulation as pre-programmed in the app, both vaginal and anal. General advice for using electrostimulation. Electrostimulation can be used for various therapies. It can elicit a sensory, afferent, stimulus and a motor, efferent, response. When electrostimulation does not result in a perceptible stimulus, sensory reaction, or muscle contraction, motor reaction, this may be due to a current intensity too low to be felt or to cause a contraction, the location of the stimulation, electrode selection, non-optimal stimulation settings, insufficient, excessive, or incorrect type of gel, nerve damage. Possible solutions. For internal palpation prior to biofeedback and electrostimulation, use the same gel recommended by NoVu Care. You can remove excess gel or add more as needed and reposition the probe. When the patient performs a few contractions before electrostimulation, or when you rotate the probe a few times, the gel is distributed more evenly. Adjusting electrode configuration. If the electrostimulation is not well perceived or does not cause a contraction, first change the electrode configuration. The table suggests recommended sequences. If you have selected ring-ring stimulation, we advise skipping no more than one ring. Note, the optimal configuration can vary by location, patient, and stimulation setting. If stimulation of underactive areas does not lead to a contraction, possibly due to denervation, also stimulate active areas to reach less active parts. Adjusting phase duration and frequency. If the electrostimulation feels too sensitive and sharp, you can shorten the phase duration and gradually increase it or increase the frequency. Additionally, you can slightly move the probe. For muscle stimulation, the patient can contract gently along with the stimulation, starting as soon as they feel something during the fade-in. When electrostimulation is not clearly felt, the patient gets used to the stimulation, you can extend the phase duration or change the frequency. For each change, the current intensity should be reduced. Stimulation current parameters. The yMAPLe system uses a biphasic symmetrical waveform mirrored above and below the baseline, one phase on each side, resulting in zero net charge, no positive or negative net charge. The amplitude used for stimulation depends on the patient's tissue impedance. High tissue impedance requires a higher stimulation amplitude than lower tissue impedance to achieve the same sensation. Tissue impedance varies between patients and within the same patient due to hormonal changes in the body. The optimal stimulation current, based on the EMG diagnosis previously conducted, depends on the individual patient's pain or discomfort threshold. Fade-in, fade-out option. The fade-in, fade-out option ensures that the current stimulation can gradually increase and decrease, thus preventing abrupt changes in stimulation for the patient. For patient comfort, a rest phase can also be inserted between stimulation sessions. Electrode configurations. There are 4 different electrode configurations. Ring option. You can select 2 rings. The first selected ring starts as negative, green, the second as positive, blue. Side option. You can select 2 sides, anterior, left, posterior, right. The first selected side starts as negative, the second as positive. Side 1. You can select 1 or 2 sides, anterior, left, posterior, right. For each selected side, the first, third, and fifth electrodes start as negative, while the second, fourth, and sixth electrodes are positive. Side 3. You can select 2 sides, anterior, left, posterior, right. For each selected side, the first, second, and third electrodes start as negative, and the fourth, fifth, and sixth electrodes are positive. Note, since yMAPLe uses a biphasic symmetrical curve, the polarity switches halfway through the stimulation pulse. Negative becomes positive and vice versa. Pain management stimulation options. When experiencing pain, you can choose between 2 stimulation options. Option 1, high frequency, works through the gate control theory. Option 2, low frequency, activates the thalamus and stimulates endorphin release, promoting relaxation. Both settings are useful not only for pain relief, but also for deactivating overactive muscles. Use these settings to leverage sensory effects. Keep in mind that you're working with afferent, sensory stimulation rather than motor stimulation. Precision in electrostimulation. Use no more than 2 active rings simultaneously, placing them next to each other or with a maximum of 1 ring in between. Do not bridge more than 1 ring, as this reduces effectiveness. Ring modes. Side 1, suitable for targeted muscle treatment, such as the bladder. Side 3, ideal for broader stimulation across multiple structures. Dealing with motor damage. If minimal or no activity is detected during measurements and no improvement is observed after 2 sessions, motor damage or avulsion, muscle tearing from the bone, may be present. In such cases, do not focus on the damaged area, instead stimulate surrounding muscles. Aim to restore synchronization and functionality in the rest of the pelvic floor. With avulsions, activity cannot be restored due to the lack of innervation. Focus on activating surrounding structures to optimize functionality. Quick summary. yMAPLe offers unique opportunities for diagnosing and treating pelvic floor issues, including the use of biofeedback. The grid and specific functionalities of yMAPLe enable precise and detailed analysis, leading to better outcomes and targeted treatment. What's inside the yMAPLe case? We'd like to show you the contents of the yMAPLe case so you know exactly what we're talking about. Handheld device, connected to the MPFT Wi-Fi network with reference and probe cables attached. Docking station, serves as the charging station and Wi-Fi router. Probe cable, connects the handheld device to the probe. Docking station adapter, powers the docking station. Reference cable, used for accurate measurements. Key cord, allows the handheld device to be worn around the patient's neck. O-rings for securing connections. Quick guide, handy manual for getting started quickly. Probe for internal measurements. Push-button adhesive electrodes for external stimulation. Tube of Signagel conductive gel for optimal contact. Cable covers protects cables during use. Functional training ring for targeted exercises. iPad for installing the yMAPLe app. Requirements for yMAPLe: docking station. The yMAPLe operates via a docking station that also functions as a charger and Wi-Fi connector. Indicator lights: green, active. Flashing blue, charging. Solid blue, fully charged. Red, error. If a red light appears, the handheld device may not be properly positioned on the docking station. Check if the pins are making proper contact. The docking station must always be plugged into a power outlet as it generates an isolated local MPFT Wi-Fi network between the docking station, handheld device, and iPad. No internet connection is established, and patient data is stored solely on the iPad. In practices with multiple yMAPLe systems, it's crucial to ensure you're always connected to the correct yMAPLe device.
Skin-tact adhesive electrodes. These electrodes are intended for single use only. Reuze may affect the measurement and reduce patient comfort. Place the electrodes on a bony area, such as the iliac crest, hip, kneecap, or elbow to ensure accurate potential measurement. This effectively filters out EMG interference from the rest of the body. Sleeve usage. We recommend using the sleeve to prevent gel or body fluids from getting into or onto the probe. This ensures hygienic treatment and reduces the risk of spreading bacteria or viruses. Replace the sleeve after each patient. Gel recommendations. Preferably use Signa gel or cream. ASIT is more suitable than standard ultrasound gel, which may interfere with conductivity. The functionality of yMAPLe has been fully tested with these Signa products. Functional training ring. This optional ring can be used for patients with a wider vaginal canal to help keep the probe in place. Be aware that this ring is officially intended for training purposes only, as it may create pressure or tension during an EMG measurement that would not normally be present. Always record the use of this ring in the app, and do not compare the results with the reference scale. Research has shown that yMAPLe provides accurate measurements even in wider vaginal canals, as the wall remain in contact when at rest.
yMAPLe network connection. yMAPLe operates only through a secure MPFT Wi-Fi network. Ensure you connect to the yMAPLe network via the iPad settings. The password for this network can be found on the docking station. Always verify the connection before performing measurements. Probe positioning. When using the yMAPLe probe, it is important to understand that slight variations in positioning can affect measurements. For example, in patients with prolapse, probe positioning may vary. The probe should always be inserted with a cable facing forward, anterior, whether vaginally or anally. Although it may seem easier to position the cable backward, this results in incorrect mapping on the yMAPLe grid. It is crucial that measurements from the left side are accurately displayed as left in the grid. Always hold the probe by the handle. Touching the cable can cause interference in the measurement, as the cable may pick up your own muscle activity. Note any artifacts, such as touches or movements, in your report. This can easily be recorded in the yMAPLe app on your iPad. Measurement positions. As mentioned earlier, the yMAPLe probe can be used in various positions: lying down, sitting, standing, or even during movement. However, ensure that the same position is used consistently within the treatment protocol and document this clearly in the patient's record. In practice, a slightly elevated lying position is often preferred to create natural downward pressure. Patients often experience fewer complaints when lying completely flat. Practical stability tips, if not holding the probe during measurements. Ask patients to wear tight-fitting underwear, such as boxers or briefs, or secure the probe with a towel. For side-lying positions, place the cable between the legs and tuck it underneath. Ensure the cable does not hang off the examination table to avoid interference. Reporting guidelines. When documenting results, use the standard yMAPLe ring numbering, ring 1 to ring 6, for clarity and efficiency. This prevents confusion and saves time. As mentioned earlier, you can also add notes regarding any movements, breathing patterns, or other observations during measurements. General instructions. yMAPLe is an advanced device that offers high accuracy and flexibility for pelvic floor measurements. Ensure strict adherence to protocols and hygiene measures to maintain the quality of both measurements and treatments. One. Check your equipment. Is the probe properly connected? Are you using enough gel? Is the skin-tacked electrode correctly placed on a bony area such as the iliac crest? Always use a new sleeve and a new probe for each patient. Work with medical gloves and medical-grade alcohol, 70%. Applying gel. Apply sufficient gel to the electrode. Without gel, proper conductivity cannot be established, leading to EMG errors. Personalized treatment with yMAPLe. yMAPLe offers unique possibilities for personalized treatments. By adjusting the settings based on your findings, you can work more effectively and achieve better results. Remember, the ultimate goal is to address the patient's needs, not to achieve perfect measurement values. Use yMAPLe to treat efficiently and purposefully. Continuous evaluation during treatment. It's important to continuously evaluate the effects of specific interventions during treatment sessions. If the effect is insufficient, make the necessary adjustments. Use short training periods instead of prolonged stimulation of a single muscle group. With yMAPLe, compensations, overactivity, and underactivity can be accurately analyzed. The conclusion. yMAPLe offers the potential for highly specific and effective diagnosis and treatment. The more often you analyze the measurements, the better you can link the patient's complaints to diagnostics and treatment. This approach makes the treatment process more targeted and efficient. Final words. We're almost at the end of this yMAPLe online basic training. We hope to see you again at our next courses, such as the EMG course and the electrostimulation course. Later this year, we'll also organize a clinical reasoning training where we'll discuss various cases with an experienced pelvic physiotherapist. Of course, there will be plenty of opportunities for you to contribute and ask questions. Follow us on social media, including our YouTube channel, Facebook, Instagram, and LinkedIn, for the latest updates on courses, webinars, and, of course, the yMAPLe Day on Thursday, October 16th in Bunnock. Have you already registered? We understand that you may have questions following this training. Don't hesitate to contact us. We're always happy to help. You can reach us via email, WhatsApp, or phone. Thank you very much, and see you next time.